As a medical professional, are you aware that patient non-compliance is a major cause of ineffective chronic disease treatment across the globe? Drugs don't work in people who don't take them. This observation by former US Surgeon General C. Everett Koop became famous because it seemed to be stating the obvious, but the fact is the statement is very close to the truth. Here's another interesting fact. Most chronic drugs work well in a clinical trial environment, and it is understandable that under these controlled circumstances, patients are highly compliant. But then, clinical trials don't really reflect patient behavior in the real world out there. Patients that receive no form of support typically fill around 50% of their scripts. However, a good compliance program motivates them to fill 85 to 90% of their scripts. This negative trend of medication non-adherence defies efforts to manage chronic diseases and only perpetuates the cycle. This was highlighted by the World Health Organization in 2003. It was found that 67% of diabetic type 2 patients do not test blood glucose as frequently as recommended. The study also showed that diabetic type 2 patients average only 130 days of continuous drug therapy. And by the end of the first year of treatment, only 15% were still taking their oral medication regularly. With the introduction of intelligent software, doctors can now track their patients' compliance, and the software can provide a new dimension of information that relates directly to the disease management of any patients in his care.
I must say I'm very touched that you should ring and ask me these questions. It means a tremendous amount to have someone bother to call and to keep an eye on me. So I'm very grateful to you.